Good afternoon, all. This is Dr. Ushyendra Sharma from IGMC Shimla, and I am briefly telling you about the hypertension, the diet, and the lifestyle. What changes you have to do, and what the this lifestyle you can follow for this control of hypertension. See, hypertension is basically the combination of three factors: your diet, your genetics, and your lifestyle. So it is a very important thing to maintain that lifestyle as well as your diet and activity. So briefly about diet, you have to maintain three things. Sodium, according to your, I am not telling about the dash diet, the dietary approach for stopping hypertension, which recommends 1500 or 2300 grams of milligrams of sodium per day. I am just telling about according to your activity, because when manual laborers are doing some activity, they have to require more sodium than we require, because we are moderate to mild workers, physical workers. So it is very important you maintain your chart, and the balance should be your positive sodium balance should be around 1.5 grams of intake per day. And second thing is Mediterranean diet. Lots of things are told about Mediterranean diet and this dash diet. Yeah, I have to say yes, it is beneficial because when you are in that activity mode, because you have to require activity as well as this diet as well as lifestyle. So when you are following that Mediterranean, lots of boiled olive diet, and this lots of salads and lots of lettuce like things, and this green leafy or this free fatty acids, omega-3 fatty acids, and other things. So you have to be like that only. So because that can lower your blood pressure up to 2 to 3 millimeter of mercury per day. So, and what about activity? Yeah, definitely. Activities, when you have to follow around 30 to 40 minutes of moderate to brisk walk per day, or around 2 to 3 hours of this moderate to this heavy activity walk, like walks, running, cycling per week. So briefly, it comes out to be around 1 hour per this 3 4 days, or something like, if you have maintaining your routine on daily basis, you have to maintain that for this 30 minutes, because daily and not you do this activity in the morning and you sit for whole of the day. No, not that like that. When you do some activity in the morning, like brisk walk for 30 minutes or something, you have to follow 4 hourly pattern, because you have to take some 10 minutes break, and you can activate, because see, not, it is not 24-hour format I am talking about. It is basically the how frequently you work out. So frequency is very important rather than the activity per day of 30 minutes, because when you start your day by 30 minutes, then you have to follow that pattern 4 hourly, in the daytime also, in the night time after light meals you have to. And it is very important you follow the diet chart as well, because when you are maintaining heavy diet plan, you have to work out according to that only. And you are like, when you are in fasting state, you have to maintain that diet, that activity, because when you are fasting for 6 hours or more, you can't work out that way, which we are following. So it varies basically. So activity varies with your diet intake, with your sodium intake, and with your exertion. Like in summer seasons, we usually sweat out a lot. So you have to maintain that sodium balance, and you have to, obviously you have to take some drinks or some this sodium intake you have to increase, because it has to be balanced, because your body also requires some. So the crux, the summary is that I want to summarize briefly. First of all, lifestyle modification. Very important, because when you maintain that healthy lifestyle of moderate activity and moderate work, you have to maintain that frequently as well as on the daily basis. Second is diet. Dash diet, Mediterranean diet, omega-3 fatty acid diet, and some salads, green leafy vegetables, lots of omega-3 fatty acids, and cut out your oil and salt intake and sugar intake. So it is very important. Second, third is activity. You have to maintain that for 30 minutes per day or 2 to 3 hours per day of this exercise, as well as your this plan for your like in fasting state varies. If you are doing some heavy to moderate work in your fields, then obviously you have to maintain that, and you have to increase your sodium intake a little bit. So that's it for today. The summary is, you have to maintain good diet, no processed food or low processed food. The what we say on cheat days, you have to maintain one this routine of one cheat day. You can take anything, but on other days you have to follow strict. So with age, like I am not saying this for lesser age group to 18 to 25, I am saying after 35. So after 50 you have to be more strict, and after 60 you have to be stricter, and after 70 you have to be very cautious. You have to be lots and lots of this activities, and this dietary, you have to be very cautious. Thank you. Thank you.